Good morning, everyone, and thanks so much for joining us here in our stream. I'm Will DuPree here in the KXAN live studio. Now, next week we would normally be getting together and looking forward to celebrating Thanksgiving with everybody that we love. However, the pandemic is forcing us to rethink our plans or even forego them entirely to keep each other safe. So if you at home are wondering what you should do, maybe having a hard time deciding what to do for Thanksgiving, then perhaps our next guest can provide us some answers and some clarity this morning. Joining us today is Dr. Mark Escott. He is the interim health authority for Austin-Travis County. Dr. Escott, thank you so much for being here and taking time today. We have been relying on you for months now, so we appreciate it.
Thanks, Will. Great to see you again.
Yes, good to see you. Dr. Escott, since our time is short with you today, I just want to jump right in and ask point blank, what should we do for Thanksgiving? Is it safe at all to gather together?
Well, I think it's important for us to remember that this year has been different, and it's going to be different for Thanksgiving and Christmas. And we have to appreciate that the disease is spreading in our jurisdiction, around Texas and around the country, in a degree that we have not seen yet in this pandemic. So we've got to take steps to make those celebrations safer. And that means we've got to alter traditions this year to ensure that we're protecting our family and our friends so that we can have celebrations with them in the future.
Let's get into that. What are some of the things you think people should do to at least be together and be safe?
Well, our recommendation is that people utilize virtual celebrations this year if they want to include members of their family or friends that are outside of their household. We know that disease is spreading, and it's spreading at times when people are less protective. We're not seeing disease transmission in places where masking and distancing are the normal practices, such as schools and workplaces. We're seeing it in these family gatherings with friends. So our recommendation is, number one, choose virtual option to include those who are outside your household. But if you decide to have a gathering anyway, to practice those same measures that you would at school, at work, and that is mask and distance within the household as well.
Is there a certain number of people that it would be safe to have at a gathering if you choose to get together for Thanksgiving?
Well, it's, anytime individuals come together face to face without masking and distancing, there's a risk of transmission. We say things like limit it to 10, not because that there's no risk involved in that, because it limits the impact of that transmission. We've certainly seen cases where one single individual in that group had COVID-19 and then multiple others will get it. I think this is particularly true for those individuals who have been engaging in activities that they were not able to protect themselves. So this may be college students, this may be high school students, this may be individuals who were involved in extracurricular activities where we know transmission is happening. In those circumstances, they need to be particularly vigilant to ensure that they can protect older members of their household.
I want to ask what your plans are for Thanksgiving. Maybe that gives us an indication about what we should be doing. For me, I know I'm going to skip going home at all and just stay here in Austin instead of going back to be with my family in Arkansas. So what are you and your family going to do?
Well, my family's in Houston, and, I would love to see my folks, love to see my in-laws. They're only a short drive away, but, we've made the tough decision to stay here in Austin and, have a meal with just our family and do a Zoom call with the extended family for the holidays. It's not worth the risk, Will. Again, we've just seen COVID-19 devastate families, and as much as we'd like to see them, we want to make sure that we see them in future years as well. So I think the best thing to do is to protect them and stay home.
All right. Well, what kind of impact are you seeing on testing capacity? Because I keep hearing this from people is that if you get tested before you go and meet up with them, then you should be fine and be able to hold some sort of dinner or gathering. Are you seeing more people wanting to schedule tests ahead of Thanksgiving? And what is that doing to capacity for Austin Public Health?
That's a great question. Well, we've got plenty of testing capacity, but we have seen a substantial increase in the requests for tests over the past couple of weeks. But to address the safety of that strategy, I'll point to the White House and the Rose Garden ceremony, and we know the outcome of that with the spread to multiple individuals. That testing will tell you whether or not the virus is at a substantial level to be detected that day. It doesn't tell you anything about tomorrow or next week. So while it is a measure, it is not a completely protective measure. And that's why, the strategies to prevent transmission have to be multiple layers. The testing is a great start if you want to get tested in advance, but that doesn't mean that you should have those interactions without the masking, without the social distancing, without the attention to hygiene, including washing your hands.
You had mentioned a lot of students will be potentially coming home, perhaps from university or anything like that. Several school districts here in the Austin area have now closed certain campuses because of new cases and close contacts potentially being exposed. What is the investigation that's underway from Austin Public Health's end into some of these new cases at schools? Are you able to determine where the sources of these infections are coming from yet?
Well, by and large, the source of the infections are what they've been for the past couple of months since schools have reopened, and that's extracurricular activities and social gatherings. We have not seen evidence of transmission in the classroom space. So, this is going back to those interactions where masking is not being utilized, where the social distancing is not being utilized. And, to some extent, I think people perceive that there are certain places which are dangerous, which is why the masking and the distancing requirements are in place. Grocery stores, schools, retail stores, etc. And that's why we're not seeing much transmission there. But the risk is the same and perhaps enhanced when we're around family and friends, because we are more likely to take the mask off. We are more likely to close the distance. We know that people are relaxed on their protective measures, so we see more shaking hands and hugging than we did a couple of months ago. And I think all these things are contributing to the spread of disease right now in America. We've got to stay vigilant. We've got to flatten the curve again. And, we're in for a very concerning winter right now, with a projection for an additional 100,000 deaths potentially by Inauguration Day. So I think we all have to get together as a community and make the right decisions to stay vigilant and protect ourselves and the community.
To see yet again cases go up, hospitalizations, and even deaths, not only in Central Texas, but across the entire state and country, how frustrating is that as a public health official to see this situation come back yet again here in our area?
Well, it's extremely frustrating, but unfortunately not unanticipated. We've experienced this in prior pandemics. We saw this in H1N1. They certainly saw this back in 1918, 1919 with the Spanish influenza. Ultimately, people grow tired of being protective. They grow tired of the vigilance, and they want to relax and get back to normal. And that's when we see the virus surge again. It's frustrating for me right now because we have very promising vaccines too, as a matter of fact, that are a month or 2 months away. So now's the time to really rein things in. Now's the time to flatten the curve as much as we can, because we know that we don't have to persist in this vigilance forever. But we do need to try to save lives right now, so that we can benefit from the vaccine and prevent unnecessary deaths. And locally here, and certainly across America.
You bring up one of those potential vaccines. Pfizer announced yesterday that Texas will be a part of its pilot delivery system. What do you think about that?
We're certainly excited to receive vaccine. Our teams at Austin Public Health have been working with a coalition of partners around this community to make sure that we're prepared to receive those vaccines and administer them in our community.
And finally, Dr. Escott, before we let you go, I have to ask, how much is a national strategy to deal with this pandemic needed at this point? From what we're seeing in this state-by-state approach, it's clearly not doing enough to bring down and stop infections, hospitalizations, and deaths.
Well, I think we desperately need a national strategy. I talked about this back in the spring when we were doing, locality by locality and state by state, and it just did not work. We had some unity in June, July, particularly around masking, but unfortunately that is falling apart again. We need a national strategy. We need a government that is coming together to ensure that the message is very clear. The threat is real, it is substantial, it's unprecedented, and that we need to agree that things like masking, like social distancing, like finding the right balance between public health and the economy is good for all of us, so that we can all get together around that mission and protect this country.
Finally, Dr. Escott, before we let you go, I have one final question. I know we have just a couple minutes. What is the current status of hospital capacity in the Austin area? We had heard rumors that potentially some hospitals had reached it. What can you tell us? What's the update for that?
Well, we've got plenty of room in our hospitals right now. We have, staff in place. We can certainly handle more patients. Our hospitals have assured us that they are still in a good situation. The concern is 3 or 4 weeks from now and what that capacity will look like. Again, we depend upon our backup plans coming from other jurisdictions. So if we face surge, if we have individuals, healthcare workers, our paramedics, our firefighters, our first responders that are out sick and we need support, we pull those in from other jurisdictions. But right now, we've got surges in El Paso who have 4,000 active cases per 100,000. We have Amarillo, we have Lubbock, we have Odessa, we have Waco, we have Dallas, we have Fort Worth. We have so many jurisdictions right now facing surge that those redundancies are gone. So we have to be very careful right now in how we act as our community, because we can't depend on bringing in other resources from other jurisdictions. And when I'm talking about resources, I specifically mean people. I mean nurses, I mean paramedics, I mean technicians. The people that we need to staff those beds, those extra beds, are not going to be there for the foreseeable future because they are being utilized in other jurisdictions. So right now we look good, but we need to flatten the curve to make sure that we don't enter that surge period of needing extra people.
Dr. Mark Escott is the interim health authority for Austin Travis County. Dr. Escott, thank you so much for joining us and still spreading the word out there about how to prevent this virus and this disease. We really appreciate it. Thank you so much for taking the time today.
Thanks, Will.
All right. Again, that is Dr. Mark Escott, the interim health authority for Austin Travis County. I'm Will DuPree here in the KXAN Live studio. Thank you so much for joining us. Everyone out there, please stay safe, stay healthy, and we'll see you back here another time. Take care.